This patient presented to us with a history of 15 years of hair loss. He himself was around 36 years old. He was a Norwood grade 5 male pattern baldness patient suffering from hair loss. It's a long duration hair loss of around 15 years. So we analyzed his donor side and we found out the average of density of follicular units in various areas of the donor side was around 78 follicular unit per centimeter square, which was slightly on the lower side. His average thickness was quite good. It was 0.094 millimeter and we were very happy with that. Average number of hairs per follicular unit were around 2.1, which is again on the higher side, and his coverage value was higher than 15.32. Total donor grafts were around 12,000 in his case. So based on these findings in the trichoscopy, we planned to give him coverage of the front and the mid scalp in a single sitting. When we measured this area in the front and the mid scalp, that was around 114 square centimeter. We planned to give him a density of 35 follicular units per centimeter square, and since his thickness of hairs was quite high, we were pretty confident that this density is going to give him good results. Based on this, we found out that he needed around 4,000 grafts to cover this mid scalp and the frontal area, and that's what we did for him. Sensitivity test, and after that we gave him antibiotics after doing an ECG also for him. Then we marked his hairline. This hairline was age appropriate and slightly on the mature side because he himself was past mid 30s, around 36 years old. He was okay with that hairline which we suggested to him. After that we trimmed his hair and gave local anesthesia, gave tumescence, and then we did the side creation, the slit making, which I did. After doing this, we changed the position to a face down position and then we started harvesting the grafts in his case. After this, our team started with the graft insertion process. 1 hair grafts were used for the hairline, 3 and 4 in the tuft area and 2 and 3 in the rest of the area. And then the hairs started undergoing the shedding phase, and then he came at 3 months where the hairs had just sort of started growing out, and then again at 4 months, and we used to do PRPs for him at regular intervals. And at 6 months here, you can see his growth. This is just around 60%, 50 to 60% of the growth, not the full growth, because full growth can take up to 12 to 15 months as well.